So at this meeting, also having the pleasure to present a poster on behalf of my colleagues from the COMMIT Consortium on what the trial we nicknamed Commander, which somehow stands for combinations of iberdomide-based therapies. And the premise of this study is to address MRD that persists after transplant. It's very fortuitous that at this meeting, we're seeing the results of the AUREGA study, right? That takes patients who are MRD positive after transplant and get randomized to REV or DARA-REV. And so you have a frame of an MRD-defined population, and you're showing by incrementing the therapy, you need to more MRD negative responses and better PFS. So our trial has some of the same population. So those are patients who receive a triplet or quadruple induction, had a transplant, have responded, but they still have MRD above 10 to minus 5. And this trial has essentially two regimens and two phases. The first regimen was iberdomide, daratumumab, and dexamethasone for 6 cycles, followed by iberdomide single agent for 2 years. And we work at different doses, and all the doses we work were found to be safe. Then we activated the second regimen, which is iberdomide, daratumumab, carfilzomib, and dexamethasone. And we also worked through 2 different doses. Both those were found to be safe, and the study is now on expansion, okay? So what we show here is the final observation of the part 1, which is dose finding, and happy to share that all the doses tested, which was up to 1.6 on the triplet, up to 1.3 iberdomide on the quadruplet, were found to be safe and could be expanded. We had no patients discontinue therapy due to toxicity. Everybody was able, who has had 6-month follow-up, was able to complete the consolidation, have an MRD read, despite the fact that most of our patients receive already a DARA-containing induction. Near half the patients on the triplet convert to MRD negative, and so far, all the patients on the quadruple, so those are patients who are MRD positive despite a triplet and most times quadruple therapy and transplant, all those patients became MRD negative after 6 months of IBER-DARA-KD. Okay, so we're of course very excited about those results. I think it's I think we're helping to develop the frame of mind that you should and you have options to react to that persistence of MRD despite optimal induction in autologous transplant. And we look forward to continue the study now on the expansion for both cohorts, for the triplet and the quadruplet, to gain some better long-term understanding of the persistence of this MRD negative and the relative impact of each of those regimens.